Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We are discussing Ratta Pitta Vyadhi and we had discussed different angles of Ratta Pitta and its relation with the Varnan like Mahavegam, Mahaghoram, Ashukari. In last lecture, I concluded with the term internal bleeding, which we'll discuss in the today's lecture. What I mean by internal bleeding, what we have seen so far, that there is something bleeding inside the body, and now it is come through any orifices, and we are seeing it that bleeding is happening in the patient's body, and we term it as a Ratta Pitta, of course without any trauma. So in Ratta Pitta there is internal bleeding already present. Then what I mean by internal bleeding, that there is internal bleeding somewhere in the body, but it has not come out of the body. We see a lot of patients of this type. For example, there is brain hemorrhage, whatever reason it may be. A patient could come with the brain hemorrhage, patient come with the ophthalmic hemorrhage, and when they come to you, you have to think of these patients also. Now, bleeding has done, confirmed. You have to nominate this patient as Ratta Pitta because there is bleeding without any trauma. It is also right. The question is, what is the line of treatment? If we are nominating this patient under Ratta Pitta, which is nothing wrong, but does the treatment of Ratta Pitta, and I am repeating, treatment of Ratta Pitta is indicated in such patients. Let me explain this in detail. Whenever there is any internal bleed and patients comes to you, if you diagnose it at the OPD level, it is a really great achievement because there are so many types of differential diagnosis. For example, severe in the case of brain hemorrhage, there is severe headache, sometimes vomiting, etc. And patient generally goes to hospital because it's a sort of severe intensity of the patient. If you diagnose it as a in your OPD level, it's really good. Or ophthalmic hemorrhage, you never see in at patient comes to you and you have at our level you even don't have any instrument also to see retina in the OPD level. So in such cases, most of the time hospitalization is necessary. At least I refer for hospitalization, and we require CT scan or MRI like investigations to diagnose such internal bleeding. Not only to diagnose but to see the exact condition intensity of internal bleed. Now patient comes to you with the report and says that I was admitted for some reason, then investigations were done and now report is saying that there are some hemorrhagic patches, either hemorrhage of, for example, as I said, in the brain area or ophthalmic area, or there is no hemorrhage but there are infarcts in the blood vessels in any organ, whatever it is, or there are thrombosed portions of thrombolized, what can say, in the blood vessels there are some thrombosed portions. Okay, so there are two things which you come across when patient comes to you after some days, many a times, that he has got this internal hemorrhage few days back, or he has some headache or some other problem, goes to hospital, takes the scan, and the scan reveals these portions of blood vessels either hemorrhaging or having infarcts, ischemia or thrombosed portions in the arteries. Now, if there is hemorrhage, of course, you have to name it as Ratta Pitta because it is bleeding without trauma. Question is whether you are going to treat the patient with the Ratta Pitta Chikitsa which we have discussed. What is Chikitsa we have discussed? Titta Ras, Shita Guna, Stambhani Himaha, Ruksha Guna, and all together are responsible to achieve the Rakta Stambhana. Okay, now always keeping in mind this line of treatment is suggested when there is active bleeding. You are already seeing the blood vessels bleeding, and to stop that blood vessels immediately, as a Rakta Jivan Iti Sthiti by rule, you have to use all these Madhu Titta Kashaya Shitavya Ruksha Guna. I repeat it again that you are clotting the blood after such line of treatment. We are making the blood to clot Stambhane Himaha by such line of treatment which is suggested in the Rakta Pitta. And this line of treatment again have been suggested when there is active bleeding. I am repeating it again and again. Now patient is in front of you, has said that the problem of the bleeding hemorrhage, internal hemorrhage, was few days back, and report in front of you says that there was bleeding. The bleeding is it active when you are seeing that report or patient? No, it was done few days back. It was happened few days back, and that moment you are seeing the patient is a already clotted blood. Hemorrhage is abnormal, so you have to think of treating the patient, but that hemorrhage after some days is in the form of clotted blood. Though it is Rakta Pitta, it is not active bleeding after few days of Samprati happened in the patient's body. I repeat it again because it is very important in relation with Chikitsa, which I will, why it is important, I will explain it in the few time. When a patient comes to you with the report that there was hemorrhage in the body, in any organ, report says that internal hemorrhage in say brain, in the ophthalmic area or anyway, and now patient is expecting you to cure that hemorrhage. Though it is Rakta Pitta, always remember that it is already Rakta which has Stambhan, Rakta which has already clotted. Okay, only thing it is in the hemorrhage means it is abnormally clotted in the out of periphery of blood supply or blood arteries of the body. So you have to think of that, no doubt, but though you have to name it Rakta Pitta as it is bleeding without any trauma, as it is internal bleeding, and if you are seeing patient after few days of the Samprati, then remember that it is not active bleeding, it is a clotted blood, and hence though it is Rakta Pitta, you have to think in other way in the Chikitsa. I will conclude this on this note today because I will give you time. What I am saying you is appreciable to you or not. Just think over it that it is Rakta Pitta, but it is already clotted blood, and hence Rakta Stambhan Chikitsa may not be indicated in such patients because it will clot the blood much more at much more level. So what should be done, we'll discuss in the next lecture. Just think on my opinion and share your opinion also. Please subscribe this and also tell your friends to subscribe the channel Clinical Ayurved by Dr. Mayuresh Agte. Thank you very much.